Well, let's discuss the GP experience with a GP. Dr. Robbie Cool joins me. You practice, I gather, in a GP practice in Strathclyde in Argyll. Thank you very much for joining us. Absolutely, we want to hear your experiences firsthand. Are lots of your patients really pretty demanding these days?
Well, I've got quite a small practice, and I know my patients very well. But I've worked in other practices as well, and in larger practices. And I think there's a message going out to patients that has been for quite a long time, saying that this is a bad thing, that we're going to have bad outcomes in the future for ourselves and our children and our grandchildren. I think that message is getting across to many patients. Patients, of course, and doctors both want that problem not to happen. But there is a minority of patients that you do encounter who have fixed ideas about antibiotics, who believe those antibiotics will make them feel better, and that they need those antibiotics. And that can be quite a challenge when they present in front of you, yeah.
A challenge. I mean, I appreciate you're using very polite diplomatic language, but I mean, do you not feel that if you're in a position where someone says to you, I really think I should be having X, that you can, in the nicest possible way, point out that you're the individual who's done 7 years of training and more, and you know that X actually isn't the best thing for their condition? I mean, can you sometimes reach a point where you just don't feel you can say that?
Oh yes, I think GPs feel that all the time. I think we've got to remember GPs are very collegiate people. We work with our patients for their health. So I think most GPs will work very hard to avoid conflict. Some GPs are afraid of conflict. And I think there is a fear amongst GPs, and GPs are definitely frightened in many respects regarding the complaints culture, regarding particularly there's GMC guidance, of course, stating that if the patient and the GP disagree, that you still, after explanation, the patient doesn't agree with the plan you've reached, you have to offer them a second opinion. And if you don't do that, then you're in breach of the good the guidance of good practice. So yes, I think there is a big fear there with GPs about the conflict that they can ensue.
And the idea, the suggestion that, well, the recommendation that GPs certainly should be looking out at other doctors if they think other doctors might be over-prescribing. I'm not sure, A, how you would know, but also, B, what you would say to a colleague if you really thought they were prescribing too much.
Well, I think we've known what to do for quite a while. I mean, we've been talking about this rather depressingly since I was a medical student. And you're right, how do we know when we're over-prescribing ourselves or for our colleagues, when we have very good data in the UK to look at that? I think the problem is that a lot of these guidance, and there was a 2011 systematic review that looked at that, saying the problem we've got is that we're saying these things, but what are actually the behavioural things that are stopping us from doing it? We know what to do, we know the guidance, what's stopping us from doing it? And I think we need to look more closely at those factors, which are quite multifactorial. There's a lot of factors involved. There's fear on the patient's part because they're frightened because they're ill. There's fear on the GP's part that they're going to fall out with the patient or get upset. The patient get upset with them, or they're going to get a complaint. And I think we need to look at how we can deal with that, particularly in view of falling funding in GP. GP's been underfunded for years. We've got a recruitment crisis. We've got far too much work for the number of patients we have. We have patients who are getting older. I think that's going to be really difficult.
Well, it is very, very interesting to hear your perspective. I have many more questions I could ask you, but thank you very much for your time for now. Thank you, Dr. Robbie Cool, there joining us from Glasgow. Thank you for your time.